We begin with the latest from the Health Ministry that the number of confirmed COVID-19 cases in Jamaica is now at 13. The revelation was made at a just concluded press conference held at Jamaica House. Health Minister Dr. Christopher Tufton added that contact tracing is also being done in another 3 to 4 communities. Our reporter Dwayne Anderson is live on location and joins us now with a brief outline. Dwayne.
Thank you, Herman. So the number of confirmed COVID-19 cases in Jamaica increased today. There are now 13 confirmed COVID-19 cases. The update was given by the Minister of Health, Dr. Christopher Tufton, earlier today, or a short while ago.
Again to patient 1. This particular one is linked again to patient 1. Remember, I replaced 0 with 1 last evening. So this is the first patient from the Bull Bay area. Another positive test linked to patient 1. It also justifies for us why we took the decision to quarantine that Bull Bay 7-8 mile area, because so far the numbers that are linked, if they were moving about, it would certainly create greater spread depending on where they would have gone and who they came in contact with. Tomorrow we are going to be doing an additional 11. Well, we have slated 11 tests to be done, I hope between today into tomorrow, and we will give you information on that as it unfolds.
Over 12,000 residents are now quarantined in Bull Bay, out there in the 7 mile and 8 miles community. Now, we've been getting reports of persons complaining that they've not been able to access food. Now, it is partly the government's responsibility to ensure these persons have access to basic necessities. The Minister of Health addressed that concern.
We have heard yesterday that some persons were suggesting that they were not getting these packages. We have indicated that to the team on the ground. We reiterate again that for persons who feel deprived as it relates to food items or basic essential items, that they report that to the personnel who are placed or based at the locations, and we will do the necessary follow-up. We've also engaged in conversation the NGOs, the typical NGOs that have been accustomed to providing support in circumstances of this kind, the Salvation Army, Food for the Poor, and there's one other, I think. But we are also the Red Cross, so we're mobilizing them to be a part of any support services to those persons in the area. The National Health Fund Drug Serve Mobile Unit has been assigned to provide pharmacy services, and I believe they should have been there today. If not, they certainly will be there tomorrow. And that would address persons who need medical support or drug services. The unit will drive through the communities, stop at the command post, and establish 11 checkpoints, 1 at the entrance of Shooters Hill, 2 at the foot of the hill, and 8 along the Bull Bay Main Road to Paul Road that leads to the quarry and close to the bridge. These points serve as drop-off point for prescriptions along with the medical post.
Now, it is important to remember that Jamaica's borders are not closed, so tourists are still coming into the island. Some of them are staying at hotels. So what about them? The Minister of Health, Dr. Tufton, also gave an update about the protocol that will govern them while they're here.
And in the case of hotels, we want to just emphasize that there is a restriction around quarantining, but the guidelines for hotel quarantining are as follows, and I'm going to just cite the sort of significant features, just to be clear. So guests are allowed to move in and around the hotel. So it is not, and let me repeat, it is not a restriction to the hotel room. It's more a restriction to the hotel property. Persons can go to the pool, they can go to the beach. What we are emphasizing, however, is that we, as best as possible, and the hotels have to do this, maintain the social distancing that we have been promoting because of to minimize the risks of spread. To the extent that guests do not have symptoms, if they have symptoms, they have to be confined to the room, and there's a protocol in relation to notifying the health authorities. To the extent that they don't, then they can move around. And they can, and just to be very clear, they can return to their country of origin anytime within that 14 days. So we're not suggesting at all that persons who come in and under these new guidelines are going to have to spend 14 days in the hotel. If you book your vacation for 7 days, then you certainly can come, stick by those rules, and return within the 14, unless you have symptoms. If you have symptoms, then clearly you really need to be in a hospital and need to be treated.
Now, the officials in the press briefing a short while ago outlined that 11 tests have been done and the country will get the results of those tests by tomorrow. Now, if 11 tests sound like a small number to you, the government is assuring us that it is not because of their inability to test. They say new testing kits came in today.
I want to say that we have sufficient reagents to test. We have enough to test, is it 2,500? Approximately 2,500 tests. We just got new stocks, is it yesterday or today? Yesterday. And we are ordering additional in anticipation that this will last for a particular period of time. So there is no issue right now as it relates to our capacity to test. A number of persons have been saying, why not try to expand testing, and to get rapid tests so persons can go to several locations to get the test done. Just to say that this is not possible at this time. For one, the reagents or materials are not readily available. This is a developing situation. Secondly, persons have to be trained, and the persons who do the testing now at the National Influenza Center at the university were trained by the Pan American Health Organization, so it's not something you can just distribute. It has to be done under controlled settings.
Now, the Prime Minister and his convoy just drove by us a short time ago. I use that as a perfect segue for my next point, which speaks to nurses. The nurses, they've been having problems getting to and from work as a result of stigma. The Minister of Health outlined some good news for the nurses, which should come their way soon.
The nurses and the challenges that they face, the frontline workers, tomorrow, this is in regards to transportation to and from work and the discriminatory practices that some taxi operators have been engaged in refusing to take them back or forth. We have condemned that action, and I've had discussions with the Minister of Transport, and I know he has taken up some of the concerns with the different associations. I've had dialogue with the nurses and the President in particular, and we're going to be looking to see what arrangements can be made to give some critical support to our frontline staff. It may not be taking you from work to home, but certainly taking you to a central point. A number of hospitals currently do that. We're going to be reviewing it to see what else can be done. In addition to that, tomorrow I am going to hand over, assuming we can get the logistics right, if not tomorrow, the next day, 5 new buses that have been purchased for the nurses to provide critical transportation to those central points. And I know 5 is not enough for the entire country, but it's certainly a good start. We will also be talking to the management of the hospitals to see what other arrangements can be made.
Now, just 2 quick points before we go back to the studios. The Minister of Health was also quick to point out today that some of the testing that have been done really is as a result of flu. The flu is going around, so some of the persons who've been tested, they've really come back with results of the flu. And also, Stigma is a big part of this COVID-19 fight in Jamaica. A lot of persons in communities are targeting persons who they believe might have the virus or they believe might have had contact with persons who have the virus. They're sending them threats against their lives and property. The Minister of Health is appealing for those persons to stop. We'll be tracking this issue, and as soon as we hear anything else, we'll be sure to bring it to you. Back to you guys in the studios. Herman?